So next I'd like to invite Nick Adkins up to the stage with the startups from last year for what we call our coffee break. Nick, and if I get all the startups from last year to come up to stage. And while Nick's coming up, he is a former suit-wearing MBA for the Vanderbilt Health Plans in Nashville, Tennessee, and then he changed his attire a little bit and decided to come up with this idea of pink socks. So before we get started, you want to say a few words about why we're all wearing pink socks?
I'll do that.
And pink pins. No, I don't think so. Yeah, there you go.
Good morning. Hello, everybody. Is everybody awake? Raise your hand if you've heard of the pink socks. Yeah. Raise your hand if you're wearing pink socks. Yeah, even better. Awesome. So a little bit about the pink socks, and I'll give you the update on the pink socks before these guys give you their annual update. The pink socks is just a bunch of people who like to see the good in the world and trying to make a difference. One smile at a time, one person at a time, one interaction at a time. We can't always control the government and politics, and things aren't always the way that we want them to be. What we can control is how we deal with each other. And if we can do that with a smile, then we've created some good energy in the universe that day. So that's really what the Pink Socks is about. The Pink Socks tribe around the world now has grown to over 20,000 people. People who are gifting socks at will to represent all kinds of causes, all kinds of work that they're doing, from breast cancer awareness in India to feeding hungry children in Chapel Hill, North Carolina, to quality and patient engagement in hospitals across the U.S. and Canada, digital innovation in pharmaceutical companies across Europe, and on and on and on the list goes. So it's just for fun, and for those of you who have the Pink Socks, you know that. We're now in Pink Socks 2.0. So what you have out there now that you're wearing are Pink Socks 1.0. Those are OGs, original gangsta socks. We've got some 2.0s. I hope you're going to get some sometime today. So, but I want to start the session before we get in with these good folks. And what I'd like everybody to do is stand up where you are. And I'm going to count to 3. And on 3, I really want you to yell out. I mean, on a good Sunday morning, let's wake ourselves up, yell. I want you to yell yes on 3. Ready? 1, 2, 3. Yes! Say it again. Yes! All right, sit down. Now what we just said yes to is we're going to say yes. We're going to say yes all day. Yes to opening our minds, to letting go of what we think we know. We're going to say yes to some new ideas, some new innovations, some new ways of thinking, and we're going to let go of some expectations and some judgments and some preconceptions and just say yes. We're going to allow ourselves the permission and the self-space to do that today. And if you do that, I promise you, we're going to walk away with some really cool, mind-blowing stuff that you can take back and apply. All right, enough. So, if you were here last year, you remember all of these awesome people. We talked to them about what they were doing, and so this is a recap to say, hey, what's happened in this past year? What are some of the really cool, awesome things that your companies have done? We're not going to pitch. We just want to say what new, really exciting things do you want to share with the group that have happened? And I'm going to let each of you go down the line. We're just going to go straight down the line and introduce yourselves, tell who your company is. Hey, man, how's it going, Todd?
Good.
And then I'll ask each of you a few questions as we go along. But let's just start with just telling us who you are, what the company is, and some of the really cool things that have happened in the past year.
Great. Good morning. Everybody seems familiar in this room. Good to see everybody again. Todd Johnson, CEO of HealthLoop. 2017, as crazy and weird a year as it was from a regulatory perspective, it was kind of a kick-ass year in terms of seeing digital health therapeutics, not just in orthopedics, but across the industry, really reach a level of scale and maturity that I think is starting to be really damn impressive. I think the things that I'm most proud of for 2017 is looking at many of those in the room that we've collaborated with on research and looking at clinical outcomes, whether it's a large study we did with Anthem Blue Cross, which I think is going to be shared this afternoon by our CMIO, that demonstrates true cost savings and quality improvement to studies that were done at UCSF and other clinical organizations around the country. It's a year of real validation, like actually seeing the data come back, proving that patients patients, when enrolled on these digital therapeutics, are getting fewer adverse events when they're getting them, capturing them earlier, costing less, getting better, having better experiences. So it's nice to see these things come to scale and actually have a meaningful, valid impact.
Awesome. John?
So hi, Jean Drouin, CEO of Clarify Health. We're a machine learning company that optimizes care and helps physicians and health systems to take on risk either in bundles or population health. And I very much echo the same things. Even though it was crazy on the outside, I think we will look back to 2017, 2018, 2019 as the time, a little bit like the late 90s. Now, I know that might cause some trepidation, but that led to the emergence of the platforms that optimize and change care. Now, that we will look back in 10 or 15 years, but it's out of these types of efforts that this will come. Now, my bullishness around that is around a couple of things. We actually now can link an enormous amount of data at patient level. In a fully HIPAA-compliant way, in ways we couldn't do before. And we can now have large enough data sets to do the machine learning that provides the kind of precise and personalized care that you referred to. And it's now moving out of just genomics and into workflow. And really, the cost and the angst is stuck in the workflow. It's not stuck in the genome. So for us, the exciting things were our first customer, John Muir Health, came first in California and fourth in the U.S. out of 800 hospitals in CJR in terms of total bonus earned. Several large health systems signed on. We raised $17 million. So, and really coming back to this conference is a real gift because it's where it all got going. We met 2 or 3 people here last year that are now the folks that we're actively growing and scaling with. So looking forward to this conference. Thanks.
Nico.
I think this conference will mark the annual year marker of us all leveling up, right?
Yeah.
So as I was thinking back on that, last year around this time, my name's Nico, president of Redox. We are an infrastructure company, so we are kind of behind the scenes powering a lot of the applications and digital innovations that are being adopted by health systems. And we started the company about 3 years ago to help startups, to help the developers who are out there trying to make a new tool and get it to market for the first time. And so us being a startup ourselves, we're learning along with them. And I think the big change that's happened over the last year is that we've seen them mature and we've seen them start to scale across the country. That's largely because their products are getting to a point where they can actually serve a real purpose. But what we've also seen is health systems have a sea change of how they're actually looking at digital medicine and how they're adopting it. The big change from the infrastructure side is that before infrastructure, the integration piece of it, the interoperability piece of moving that data from the EHR to these applications was a means to an end. It was a means to power that software. But now what we're seeing is health systems seeing that as a fundamental piece that will accelerate innovation. So the big change for us at Redox, as these startups pulled us in, last year about this time we were in about 40 health systems. Now we're in about 200. So massive adoption of this technology across the country. And then what we've seen is the beginnings of network effects. Once we are implemented at a health system, they can start adopting more technology rapidly, starting to see turnkey type integrations of digital health solutions, the 24-hour go live, where they kick off a project and end users are using it 24 hours later. Things like that are now possible due to this infrastructure being adopted. The other big change for us is us directly partnering with innovation departments at health systems who are trying to figure out ways to adopt and pilot technology in a fast way. So we had some big success out in the East Coast with Brigham and Women's, part of Partners, where most of their digital tools, anything that needs to be integrated with the EHR now goes through Redox, so it can be a standardized kind of single point where they can manage that and turn on applications really rapidly. So it's been an amazing year, and what we're really excited for this year is trying to figure out, obviously we want to grow the 200 health systems, but we also want to, within those organizations that are using us, see how many applications we can get them to try, get them to use and experiment with. So excited to meet folks who are on that journey and see if we can help anyone else out. We met a lot through this program last year.
You had a baby in last year too, right?
18 months ago.
Okay. All right.
Hi there, I'm Bree Cunningham with Code Technology. We collect patient-reported outcome data for hospitals and private practices, predominantly in ortho, but we do cardio and a few other interventional-based modalities. So in 2017, that year the regulatory market was crazy, and the theme for Code and our clients was data utilization. We have a lot of private practice clients that were in commercial bundles and big bundles, BPCI particularly, and they now have enough patient-reported outcome data where they can pair long-term outcome data out to 3 years with that 90-day episode. And what was really cool was seeing them change their behavior, and instead of treating patients to make this bundle work, they're actually treating patients to make the patient better. And it's been really fun watching that be incorporated into day-to-day practice. So I'm looking forward to doing more of that in this next year and also doing more research. So we have a bunch of data. Now it's time to put it to use. It takes a long time for data to be meaningful. And now I feel like all these organizations are coming together with companies like Redox where you can actually go back, and we use Redox for a lot of our clients, and you can really, really get granular information for cost and outcome data like that. So exciting time in 2017, and can't wait for 2018.
Awesome. Hi, I'm Jamie Edwards. I'm the CEO of Cloudbreak Health. Cloudbreak is a unified telemedicine platform that's in 700 hospitals. We were at 300 about this time last year, so the company's been growing pretty rapidly. And we're actually doing 75,000 encounters a month at this point, which makes us almost as large as Teladoc in terms of the number of encounters that are going over the platform. Some of the advancements for us that have happened in the course of the past years, we've actually significantly expanded the number of use cases on the system. So what originally started as a video medical interpreting company bringing interpreters to the point of care is now doing telestroke, telepsych, developing telesitting apps. One of the most exciting ones that we're working on actually right now is actually with sleep apnea, which happens to be one of the largest, any ER you go to, like the number 2 comorbidity of any patient that's in that emergency department happens to do with, poor sleeping habits and sleep apnea. As far as 2017, I think it's really interesting that most of the companies up here are in and around how you unlock data and make it useful. EMRs have been around now for a long time, and there's so much, I don't think they've ever reached the promise that all the doctors in the room probably like, well, they were supposed to be great, and what they really are was a glorified cash register. But now, right now, with the companies that are sitting up here, you're getting to see how we can actually make this data valuable and useful, and that's a key part of telemedicine. Something that we saw over the course of the last year or two is a lot of the telemedicine initiatives that were in market were funded by grants. And, those grants now, all these hospitals and health systems have to make a decision about what the next steps are. And what we're seeing is, as opposed to telemedicine being the new medicine, it's becoming an integrated part of how people just practice. And that, to us, is one of the big advancements of the last year. We look forward to meeting people.
Hello everyone, my name is Brent Nicholson. I'm the COO at Carrum Health, and Karam Health is a bundled payment company, and what we do is essentially connect providers who are offering bundled payments into the commercial marketplace to self-insured employers. And so, for providers who are already developing the capabilities or the infrastructure around bundle payments in the Medicare space, or are watching that happen and are thinking about it, Karam Health essentially becomes a distribution channel to take those efforts and bring that provider into the commercial marketplace. So 2017 was a big year for Karam Health in terms of the demand side. We compared to where we started, comparing the start of the year to the end of the year, our client base grew by a factor of 50, and we signed up some of the largest self-insured employers in California, and we're continuing that momentum into 2018. So throughout the year, we implemented those clients. We developed some predictive analytics to comb through that our employers' claims data and identify individuals who are in need of these types of services, and then run targeted engagement campaigns to them to try and get these patients into the bundle rather than using the traditional fee-for-service insurance ecosystem. So we also received a lot of good validation from the market. We won a Harvard Business School, Harvard Medical School Health Acceleration Challenge. We were invited to present at the National Business Group on Health in front of some of the largest employers in the nation. And Sally Wellborn is the former head of global benefits of Walmart, who essentially pioneered this Centers of Excellence bundle payment type model for Walmart and several other large employers. And she has since left Walmart, but is now joined Carrum's advisory board. So essentially, we're looking to continue growing next year, expanding to more markets, expanding to more providers. And so looking forward to chatting with anyone who might have an interest. Thanks.
Hello everyone, my name is Tash Feen and I'm the CEO of Cloudmed-x. And Cloudmed-x is an AI platform that helps doctors and patients make better decisions about their care through NLP and machine learning. And I think 2017 was very exciting, both for the field of AI as well as the field of healthcare. On the healthcare side, doctors were opening up their data, hospitals were opening up their data, and at the same time, AI was advancing so fast. You had neural networks, helping doctors in radiology, you had neural networks helping doctors in diagnosis, et cetera. And so we've moved, in 2017, it shifted from, I don't want to share my data, to not only sharing data, but tell me more about AI. And that's why it's so exciting for us. We were at NIPS this year and talking, there was an entire session and track on healthcare, on how AI is advancing healthcare and how it could help. And so 2017 was very interesting because we had to do less education and more deployments and more work. So we got to work with UCSF, with Mount Sinai, and a couple of other large health systems. The problem with healthcare is the bigger the health system, it's harder to use their logo and brand name. And the predictions that you're doing because it's so many things involved. But I think mid of this year we're going to start publishing some very interesting case studies in areas of predictions of congestive heart failure, transcatheter valve replacements. And so 2017, when we were here last year, was the year where we had built the AI that understood everything from a primary care perspective. And over the last 6 months, we've built subspecialty areas into orthopedics, into cardiology, into stroke management. And so now we can predict a lot more things just looking at the data, whether it's coming from sensors or labs or pharmacy or EMR. Not only structured data, but unstructured data. So you can talk to the system and the system talks back to you. So that's what's so exciting.
And Tashveen, I don't even really know if you can talk about it, and I may be getting you in trouble, but you guys won a very prestigious...
we can't talk. No, we can't talk about it right now.
Okay. They won a very prestigious award.
We won a big award, but we can't talk about it until next week. So sorry about that.
Congratulations. Thank you, Stefano, for putting this on, and congratulations to everyone for 2017. I think we all had a banner year for many reasons, and looking forward to 2018. I'm Megan Conroy, and I'm the CEO and founder of Captureproof, which is a visual health record enabling your patients and yourselves to document and track patient healing through photo or video and serially capturing those images. There's about 4 things I'd like to tell you. We have 53 subspecialties on Captureproof and are live in 11 countries. So the first data point that I want to share is with epilepsy outside of your world, but Captureproof last year had 99.996% time savings to epilepsy diagnoses, and Mayo just presented data at the American Epilepsy Society and added a 9. So we're 5 9s and 1 6. So the ability to really see what patients are trying to talk about has an exponential change to what you all are doing. In ortho, Dr. Beanie and I actually work together, and we'd all love you to try curbside.captureproof.com. It's Snapchat for doctors. You actually have the ability for secure temporary messaging, so when someone's calling you up and asking you if you want to see that referral, they can add some photos or video, and you can make a better decision. We've launched our computer vision. We call it computer vision, not AI. We're tracking change in color, change in texture, and also range of motion. So you'll see later that we can tell you your range of motion of the knee just from a video alone. And the biggest thing for us this year within our company is we hit break even. So for any company being able to never ask anyone... Yeah. So, I don't want to ask anybody for money anymore except for my customers who are loving my product. So I look forward to more. Come on board.
All right, that's great. So I'm sure there's other entrepreneurs in the room, and what we've heard is not only have these folks survived last year, they've all thrived. I mean, the multiples that have been cited here for growth are really quite fantastic. And so, we all go to a lot of conferences, we hear a lot about patient engagement, but now it sounds like providers are engaged and facilities are engaged, which is really what we needed. So I'd like to, I have a few more questions, but I think all of you should give all of them a round for being successful. So, yeah, hashtag startup life. It doesn't always end like this. So it's good to have some successes up here. A couple of questions, Todd. I want to ask you about HealthLoop, and I've really been excited following you guys and watching what you're doing. So tell me, what's been the best way for you guys to grow? Who have you partnered with? What's been your best vehicle to get adoption?
Yeah, I think that one of the things that's challenging about the healthcare market, we all know this, is distribution into provider organizations is hard, particularly as they get bigger and bigger, and you're selling not only to independent practices but health systems. So I think you've got to find a lot of smart lanes to get there. I think the easiest, best, and most frictionless is kicking ass with your customers and earning the right to that referral, right? Having someone who's trusted that can help you with, nothing goes viral, right, in healthcare, bacterial at best. So you can get that one push and that one push. So I think that's number one. I think number two is really sort of the brute force work to get in front of the right people at the right time with the right message. But third, there's great partners that can help you. You've got medical device companies that have relationships with physicians around the country. You have IT companies that have relationships with provider organizations. So aligning yourself with partners that have aligned incentives that can grow. I think, it's getting in the door is one thing, but then blowing the door open and expanding is a whole different challenge. And so the set of tactics you need to actually then expand and get, across either a health system or across an independent practice and reach a level of scale that's interesting requires, attentive detail to outcomes, money, account management, making sure everybody is aligned on where we need to go and why. Awesome.
And Nico, I kind of consider you the resident EHR expert here, so I'm going to ask you a question about where do you see EHRs going in the near term? So, and I'm talking the big players.
Yeah.
What's going to happen to them? When do they really turn into a PHR? If they do turn into a PHR, what do you see?
So, how many doctors do we have in the room? And keep your hand up if you love your EHR experience.
Wait a minute.
Sorry,
that's a zero. For everybody out there that can't see the hands, it's a zero.
So the government gave us the gift of meaningful use, so we could all have the EHR. And now that we all have it, we're really challenged to try to figure out how to utilize it in a way that actually makes us more productive, that creates better outcomes for patients, and creates better experiences for all of the care teams. And that's what I think the opportunity is moving towards and where EHRs will get to. And it's not that the EHR is going to get to it, but I think that the innovators around the EHR are going to build the tools necessary to actually provide that user experience and that efficiency gain that was really the promise of the EHR. I think it starts with understanding the workflow, some of the design thinking that we're going to talk about in the conference later today, but understanding what you're trying to accomplish, building the right tool for that, and then working backwards from that to understand how does that need to interact with the data. So that's the exciting part that we're starting to see, is that health systems are getting more and more comfortable with saying, during the meaningful use era was the EHR is going to do everything for me. And now it's the EHR is turning into the backbone, the database, and we're going to use the best tool for the job at the user experience level.
And how far away from really using NLP are we? Natural language processing, like Siri, Alexa, et cetera.
There's definitely been the kind of dumb versions of it where, the dictation that's been around for a while, that's getting smarter and better, and I think that that's going to continue to improve. The challenge is that those companies have developed partnerships with the EHRs so that the the set of companies you can use for NLP is fairly small for the big EHR vendors. So as we see more players enter the market with third-party applications, I think we're going to see a lot more innovation there, and hopefully we'll see that accelerate.
Cool. And Jamie, I want to ask you, from where you sit with Cloudbreak and all the stuff you see out there, what's really going to happen in 2018? What's the big breakthrough in digital health this year?
Put on my genie hat for a second. Yeah. Stare into my crystal ball. Look, the tectonic plates of healthcare are shifting under our feet. When you see the largest nonprofit health systems in the country all merging, so Providence Ascension being announced, CHI Dignity, those are huge deals. There's been a lot of talk about single payer here in California, but what about now single provider? We're kind of seeing the evolution of health systems realizing that the little silo that they sit in, that they can't get the economies of scale. They can't, drive care standards and do all the things they want to do unless they get bigger, because the cost side of it is just so high. So I think we're going to see a lot more of that in 2018, and quite possibly, CVS, Aetna, right? Who thought that was going to happen? And it did. And I think you're going to see a lot more of that type of vertical consolidation coming up. And I think there are going to be some deals announced in 2018 that really surprise us.
Cool. Pass the mic down to Megan. So I want to ask each of you to answer this question and just pass the mic down the line here. And I want you to say what you think the big thing in 2018 is going to be. Is it blockchain? Is it AI? Whatever. Don't say, if it's your company, don't say your company. So Tashfeen, you can't say AI. But I just want to see, we all go to a lot of conferences. We're all plugged in. What do we really think is going to be the big thing this year?
I think there's going to be hype around blockchain. And I think that there's going to be actually execution around the patient empowerment platforms.
AI?
No, you can't say AI.
Telemedicine could be big, yeah.
Yeah, perfect.
Yeah, I put my money on telemedicine after AI.
I'll just say what we see happening is employers who represent a gigantic piece of the purchasing puzzle in healthcare continuing to wake up, especially self-insured employers, realizing that they're the ones paying the bills. They can actually take control and not just sit there and essentially follow the lead of the carriers and the insurers. So we see that continuing to happen.
I think when we look into the market, it's technology that's actually making the healthcare experience more human as opposed to getting in the way. That's something that we see hopefully happening coming up in 2018.
So in 2018, I think a lot of practical implications and utilizations of these tools. So I almost think of it as like a stagnant year where we're really learning. I would love to say AR, right? But I think that there's some time before we're really there, to be honest. So I think in 2018, we're going to see a lot of innovative providers and groups actually have practical implications of these tools and figure out how to use it in their day-to-day practice rather than just one-offs.
Yeah, I'm right there with you. I think that in healthcare, we don't necessarily have an innovation problem where we don't have the right and newest and coolest technology. A lot of that stuff is being developed, but we have an adoption problem where we just need to get it in the hands of the right people and the right patients to actually improve the care experience. So I'm thinking that 2018 has all the pieces aligned where we can actually start seeing adoption happen more rapidly.
I think one of the big things we're going to see, and it's in orthopedics that it's going to happen first, is independent physicians beginning to take back control of the health system by volunteering to take on commercial risk. The conversations at the latest AUKUS meetings were just a harbinger of what's coming, and then it's going to go cardiac, oncology, maternity. And in 2 or 3 years' time, it's going to look very, very different, and it poses really interesting questions for health systems.
I think 2018, it's all about the American dollar. I think this is going to be a fantastic year across the board for so many digital interventions where now doctors can get paid directly from CMS and commercial payers. And I know sitting back in a fee-for-service world is I love it. It makes it a hell of a lot easier for all of us to get reimbursed for the good work we're doing, and we don't have to rely on faith for bundles. So we're going to see this stuff go well outside of total joint replacements and other sort of specific bundles to broadly reaching all medical areas.
That's great. Awesome. All right, so before they go, for those of you who want some pink socks, these people are going to have some pink socks to gift you. And so if you're sitting there and go, well, why didn't I get pink socks in my swag bag? Well, they're not swag. The pink socks are always about a connection, about you having a moment with someone, introducing yourself, sharing space. It's a memento that you'll carry with you. And every time you wear them, I promise you're going to make people smile. And when someone comments on your pink socks, if they say, hey, those are cool socks, that's your opportunity to have a connection with someone that had you not been wearing these pink socks that day, the two of you would have missed each other in the universe. So do whatever you have to do what you're doing right now. We're looking at each other. So get off your phone, stay on the bar at another stop, get off your bike, say, hey, I'm Joe, I'm Brenda. It's good to see you. Everyone has a story to tell. All we have to do is listen. So give yourself the space to say yes to some of those connections. So if you want the socks, these are the people that are going to have them. Throughout the day, you come up and have a connection with one of these folks and say, hey, I'd like to have some socks. These are the people that are going to have them.
Oh, I'm going to need way more than this.
Thank you.
All right. Yeah. Megan gets the bag. Let's have a great day, yes?
Yes.
Yes! All right, thank you.